Hello. Welcome to my channel. This is Ggnp Health Information. Um, I have information for you guys for especially for minority high school graduate who graduate who have aspiration or ambition to be a medical doctor or to go to medical school. uh, I have information. My channel is dedicated in the sharing information from my experience. I am a nurse practitioner, worked in the hospital, also in the clinic, and over 14 years as a nurse practitioner, in total over 20 years in the health profession as a RN, charge nurse, preceptor, nurse clinician, and now as nurse practitioner working in a clinic. So first, I would say welcome to my channel, and hopefully you will get some information that is useful information if you're looking a career in the healthcare sector, and especially if you are looking or exploring to be a medical doctor. This is my target today. The audience that I'm expecting that to benefit from this is minority, diaspora, or minority society or community, especially kids who just graduated from high school or just about to graduate from high school, or they've been out of high school for a couple of years and thinking about to explore medical school. Those are that what I'm targeting today. So if you like this program, please share and like, also subscribe. uh, so today I'm going to talk about medical scribe. Medical scribe, or SCRIBE, is a job in a clinic or in a hospital, works with doctors, nurse practitioners, and physician assistant when they are seeing patient. The medical scribe actually types the information. So medical scribe is a suitable job for young people who are planning to be a doctor or planning to go to a medical school. And this medical scribe, I believe, is very beneficial because um, you will learn the part of the medical school, how to take a history, how to interact with patient and their family, and also all the auxiliary stuff. So you will be working side by side with a doctor, nurse practitioner, or physician assistant. So you will learn how those professional interact with the patient. We're going to talk. I'm just going to talk about medical doctors and medical scribes. So medical doctors, they go to see patient. Let's say they go to, if they are working in clinic, that they see patient in an examination room. They go in there, they talk to them, they greet them, and they ask them what they are there for. It could be the visit could be focused, maybe just one problem, or it could be acute medical issues, let's say bronchitis or something, or chest pain. It could be that. And when the doctor is interacting with the patient, the medical scribe will dictate, write, type the interaction. So the doctor will get that information, and then the scribe will save it, and for the doctor to edit it, and the doctor will add its own plan of care. So let's say somebody come in with a chest pain, and the doctor will assess, and what he hears, he will tell the medical scribe. The medical scribe will type it in. And also, before the doctor goes into the patient room or the examination room, the medical scribe will look the information, like a past history of illness, like diabetes, hypertension. It could be many things. And if this patient had surgery, what kind of surgery, who did they see, what specialty are they following, all those things that this medical scribe will collect those information from EHR, electronic health record, and they put them together for the doctor to review. And then, of course, during the interaction with the patient, this medical scribe will write all the information. Then the doctor will edit that note and finalize it, put his plan of care for that patient. Now look at this medical scribe, how much uh, you can learn just by working as medical scribe. And this is a good way to get information. And also in medical school, you have to learn how to take history, how to do examination, how to document, how to code, all those things you can learn as a medical scribe. And once you get into medical school, and when the time comes to do the rotation like that, then you will be ready and you will have a good knowledge going into medical school. So what is medical scribe? So medical scribe, as like I said, is like a typing, a person who just the doctor will dictate, and the scribe, like scribing is like a typing all the information that is uh, the doctor and the patient and family are interacting. So medical scribe, what education do you need to be a medical scribe? Okay, if let's say young people go to uh, respiratory therapist, or they go sonographer, like they become x-ray technician, or x-ray radiology technician, sonographer. If they want to go to a medical school after that, they only need 80 hours to be a medical scribe. That means you have already, anatomy and things already, so you only need the 80 hours in how to learn in uh, the coding. When I say coding, I'm not talking about computer coding. What I'm talking about is how the doctor see the patient, spend the time, put a plan of care, all that time, all that action plan for that patient. How does the doctor get paid? Or not necessarily the doctor, but the hospital or the clinic he works for, how do they get compensation? So that's what the coding means. So this is very, very important for medical school, for a medical student, or someone who's planning to be a doctor and planning to go to a medical school. You can get that down, and you will have so much information and knowledge before you go to medical school. So a medical scribe, of course, they learn how to the electronic health record, HIPAA. That means the confidentiality patient's information, that how to keep the information private. So the HIPAA, you guys know, with a lot of companies, they have HIPAA now. So you have to safeguard the patient's information. You learn about that. And also you will learn how to document, of course, what comes, like a history of present illness, history of medical history, surgical history, allergy, medication list, all those things. So as a medical scribe, you learn all that. And also, of course, you have to know anatomy, physiology, and also infection control. You know how to protect yourself, because you are going to the patient's room with the doctor. So and also how to basically how to document about an EKG result, an MRI result, or a chest X-ray result, and things like that. And also, what is the admission process? What is the discharge process? What is the focus progress note? All that things you will learn, because you're going to help this doctor save time. So for the doctor, the doctor will see more patient by doing that, someone typing the information for him or for her. So save time, and he will be more productive. So you will learn overall the workflow of daily doctor's visit. And it could be in a hospital, it could be in the ER, it could be specialty clinic like cardiology, pulmonology, urology, all those things that you will be learning. And also, of course, the medical terminology. I always talked about medical terminology when you do a respiratory therapist, a medical respiratory technician, or sinus or what else did we talk about? Professions. All those things needs medical terminology. So that's the language of the medical field. And so that you're going to learn. So if you are just coming out of high school, or you've been working something else, working like maybe in retail or whatever, but you decide after a couple of years graduating, after graduating high school, you want to go back to school and be you want to be a medical doctor. Then what you have to do is 120 hours of medical scribe program. So there are many programs that you can explore. This is kind of new, I would say, a few years, less than 10 years probably. This medical scribe has been very popular because it saves time for the doctors to see more patients. So healthcare documentation professional group, one of those groups that provide medical scribe school or program. And like I said, for someone who is just out of school, out of high school, and they will need like 120 hours of medical scribe education. But for young people who graduated with something like, respiratory therapist or radiology technician, they only need 80 hours because they have so many other science program already they have done, so they don't need to do like 120 hours. But today my focus is the high school student. The high school student, especially minority students, if they have the ambition to be a doctor or a medical doctor, I think they need to explore medical scribe. Explore medical scribe because you will gain connections, networking. I'm not talking like a social media networking, but physical doctor, physical clinic, physical hospital, that in the future they will be, there is a potential for them to be your resource person. And also, if you work for them, even there is a potential tuition assessment also, tuition assistant. And also later on, you gotta have some doctor at your corner that you can bounce off ideas. And also there's so much, you have to make a connection through becoming a medical scribe, especially for minority high school graduate who have potential, who are good in science, good in math, and they have the drive to be a medical doctor. I think medical scribe is a a good option to explore. And you can actually look into this and create a connection, create a networking, and benefit from it, because this will give you actually idea whether you can be a medical doctor or not, if you are interested in medical doctor or not, or if you are determined you want to be a medical doctor and you have all your ducks in a row, then definitely medical scribe will help you, especially like I said, is for minority student, minority high school graduate. I think medical scribe is very beneficial. It's just a tool for you, a tool to get some of the medical school stress or pressure low by doing medical scribe and learning some of the stuff about being a doctor. So that's my program today, and share this program if you like it. And also all the adults that you see, especially minority parents, friends, aunties and uncles, you see this information, share it to the young people that they can gain. So medical scribe usually pays about $30 a year. It's not much, but for a high school student who has a plan to be a medical doctor, this is like when you not it's not the money that you make while being a medical scribe, but the knowledge you're gaining for the future, the knowledge of being a doctor, that ahead of your medical school you will learn so much and you will be confident. And you will appreciate, you will see the real world that, okay, as a doctor, as a future doctor, you will see yourself in that environment. And please share, like, and subscribe if you like it. And also please pass this, share it to young people who are about to graduate high school. This is a good opportunity to put your feet in an organization or a group of doctors or clinics. So think about it, consider it, and look into it and see what you think. So it's really, I really want you, especially a diaspora, immigrant, minority. We do lack, networking, a physical networking. Like when I work as a nurse practitioner, the what I see, the medical scribe are, most of them are, their parents are doctors and nurses or pharmacists or something like that. So they have already connected. But for, if you go to that program and you get hired, actually medical scribe, you don't need to have a doctor parent or a nurse parent or anybody. So you will get into this program, and you get exposure, how to be a physician. And really, we minority high school student, they need to consider this, because we need more doctors. And that's my, my belief is rooted in the sharing information for high school students. From my experience, I want people to know, especially minority high school student, there is help out there. So you just need to explore it, and this is one of them. Thank you. Ggnp Health Information, it's a YouTube channel. Also, I have a Facebook that I stream. It's just like this now. If you go to Ggnp Health Information YouTube channel, and you can also watch other program that I have done. Usually my program is streamed in Tigrinya, that's the Eritrean language, and also Northern Ethiopia language, and also Amharic is the national language of Ethiopia, and also of course in English. And if you have any question, you can leave me a comment. This is barely a new YouTube channel. It's information about health, and also the career, healthcare career in the healthcare sector. What kind of job is out there? What kind of education do we need? Also those things. So I previously I spoke about respiratory therapist as an associate degree. I spoke about radiation therapist, and also I talked about laboratory technician, and also laboratory technologist, associate degree and a bachelor degree. So go to my channel, Ggnp Health Information, and learn about the other programs. All right, today my program is this. If you have question, please leave me in the comment section. Have a good day.